Your feet may be shouting a warning about diabetes months, sometimes years, before a single blood test catches it. A little numbness in the toes, a cut that will not heal, skin that has gone dry and cracked. Most people over 40 brush these off as ordinary tired feet, and that is exactly how a very serious problem gets a long head start. I am Dr. Hale. In my 15 years in internal medicine, I have examined thousands of feet, and I will tell you something that stuck with me early. The feet are honest. They tell the truth about your blood sugar often before you feel sick anywhere else. I have caught diabetes I was not looking for, simply by asking a patient to take off their socks. And I have also seen the other side, the people who ignored the quiet signals for years and walked in with trouble that could have been stopped cold if someone had just looked sooner. Here is what should get your attention, even if your blood sugar has never been flagged. According to the Centers for Disease Control and Prevention, more than 1 in 3 American adults has prediabetes, and the large majority do not know it, not the elderly. Adults. People in their 40s and 50s, working, busy, feeling basically fine. So this is not a someday problem. The window to catch it and turn it around is open right now, and your feet may be the clearest early sign you will ever get. So over the next few minutes, I am going to walk you through the specific warning signs your feet show first, why they show up in your feet before anywhere else, and the red flags that mean you call a doctor now, not next month. Stay with me, because one of these signs is one that people almost always dismiss, and it is one of the most important. Let me start with why the feet, of all places. Once you understand this, every sign that follows will make sense. High blood sugar, over time, does 2 kinds of quiet damage. It harms your nerves, and it harms the small blood vessels that feed those nerves. The National Institute of Diabetes and Digestive and Kidney Diseases explains that too much glucose in the blood, year after year, can injure the nerves throughout your body, and the ones that tend to get hit first are the longest ones. And which nerves are the longest in your entire body? The ones that run all the way from your spine down to your toes. Here is a picture that makes it click. Think of your nervous system like a plumbing network in a tall old house, and your brain is the water tank up in the attic. The rooms closest to the tank get strong, steady water, but the faucet in the far basement corner, at the very end of the longest pipe, is the first to sputter and run weak when pressure drops. Your feet are that far corner. They sit at the end of the longest lines for both nerve signal and blood flow. So when high blood sugar starts corroding the system, the feet feel it first. That is not bad luck. That is simple distance. Now let me give you the signs, in the order they tend to appear, so you know what you are looking for. The first sign is numbness or tingling in the toes and the balls of the feet. That pins and needles feeling, like your foot half fell asleep and never fully woke up. It may come and go at first. The American Diabetes Association points to these sensory changes in the feet as some of the earliest signals of nerve damage from diabetes. Do not wait for it to be constant. The early version flickers. The second sign is burning, especially at night. Many people describe a hot, prickling or shooting feeling in the feet that gets worse when they lie down and everything goes quiet. It can be enough to keep you awake. This nighttime burning is a classic early pattern of diabetic nerve pain, and it is one people often blame on their shoes or a long day. It is worth taking seriously. The third sign is dry, cracked skin on the feet. This one surprises people. When those small nerves are damaged, they can stop telling your skin to sweat and stay moist, so your feet turn dry, flaky, and prone to cracking, especially at the heels. Those cracks are not just cosmetic. They are little doors where infection can get in, on a foot that may already be losing its ability to feel. The fourth sign, and this is the one I begged you to remember, is a cut, blister, or sore that heals slowly or does not heal at all. This is the big one. When nerves are damaged, you may not feel a small injury, so you keep walking on it. And when the small blood vessels are damaged, less healing blood reaches the spot, so it lingers. The National Institute of Diabetes and Digestive and Kidney Diseases notes that reduced feeling and reduced blood flow are exactly why foot sores in diabetes can be slow to heal and can turn serious. A scrape that would clear up in days on a healthy foot can sit open for weeks. Please do not ignore a wound on your foot that is not closing. The fifth sign is a change in color or temperature. A foot that looks paler, redder, or bluish than the other, or one that feels noticeably cold to the touch, can be a sign that blood flow is struggling. Your feet should be a matched pair. When one starts looking or feeling different from the other, that is information. The sixth sign is hair loss on the toes and the tops of the feet. Most people have fine hair there, and when circulation drops, those little hairs are among the first things the body stops supporting. Smooth, hairless toes where there used to be hair can be a quiet clue that blood flow to the far corner is fading. Now notice how these signs work as a team, because that is what makes the feet such an early warning system. The nerve damage takes away your feeling, so you stop noticing small injuries. The circulation damage takes away your healing, so those injuries linger and grow. One problem hides the wound, the other keeps it from closing. Go back to the old house and the far basement faucet. It is not just that the water runs weak down there, it is that nobody visits that corner, so a slow leak can go on for a long time before anyone finds it. Your feet are that unvisited corner. The whole point of a daily look is to become the person who checks that corner every single day, so nothing gets a head start. And there is one more reason the feet matter so much. Nerve pain and numbness are often the symptoms that finally push a person to see a doctor, and that visit is where the whole picture gets caught. I have had patients whose numb toes led to the blood test that revealed diabetes, high blood pressure, and high cholesterol all at once, none of which they felt. The feet opened the door. Let me put a face on all of this. I will call her Teresa, and she is a composite of many people I have seen. 58 years old, on her feet all day at work, the kind of person who never complains. She had noticed her toes felt a little numb for the better part of a year, and that a small blister from a new pair of shoes had been slow to heal, but she was busy and she let it go. She had not seen a doctor in years. When a family member finally pushed her in, her blood sugar was high. She had diabetes she never knew she had, and that numbness was early nerve damage. Here is the hopeful part. Because it was caught then, she could act. She got her sugar under control, she learned to check her feet, and she protected herself from the worst. Had she waited another year or two, that slow healing blister was exactly the kind of thing that leads to serious trouble. Her feet had been signaling for months. She simply had not known to listen. And that is the message I want you to take from Teresa. This is not a video meant to frighten you, it is the opposite. Nearly all of the worst outcomes from diabetic feet are preventable when the problem is caught early. Early is everything here. The signs in your feet are a gift, a head start, if you know to read them. If this is useful so far, take 1 second and subscribe to Dr. Hale, and tell me in the comments how old you are, because the age of the people watching genuinely shapes what I cover next. Alright, back to it, because now I need to give you the red flags, the ones that mean you do not wait. Let me be very direct, because this part can save a foot or a life. Any wound, sore, blister, or ulcer on your foot that is not healing needs prompt medical care. Do not give it another week to see. If you see spreading redness, swelling, warmth, or drainage, or you develop a fever along with a foot wound, that can be a serious infection, and that is same-day care, not a wait and see. If a foot suddenly becomes very cold, very pale, or very painful, that can signal a blood flow emergency, and that also needs urgent attention. The Centers for Disease Control and Prevention and the American Diabetes Association both stress how quickly a small foot problem in someone with diabetes can turn into a big one, and how much of that can be prevented by acting early. When in doubt about a foot wound, be the person who calls too soon, not the one who waited too long. Now the good news, because there is a great deal of it. Almost everything here responds to action. The first thing to do is simple. Get your blood sugar checked. A basic blood test at your doctor can tell you where you stand, and if you are in the pre-diabetes range, that is a warning you can still act on, not a sentence. Many people pull their numbers back down with changes to eating, movement, and weight. The second thing is to look at your feet. Actually look. Make it a habit, the same way you brush your teeth. Once a day, check the tops, the soles, and between the toes for cuts, blisters, redness, or dryness. If you cannot see the bottoms well, use a mirror on the floor or ask someone to help. If your eyesight or your reach makes this hard, that is a real and common reason to see a foot doctor regularly. The third thing is daily care. Keep your feet clean and dry, and moisturize the dry areas, though not between the toes where it stays too damp. Wear shoes that fit well and do not rub, and never walk barefoot outside, because a foot that cannot feel well can be injured without you knowing. Trim your nails carefully and straight across. The fourth thing, if you have any of the signs we talked about, or if you already know you have diabetes, is to ask your doctor for a proper foot exam. The American Diabetes Association recommends a full foot check at least once a year for people with diabetes, and more often if there are problems. That exam takes a few minutes, and it catches things you cannot. Let me be honest with you here. The way this channel always is, not every case of numb or tingling feet is diabetes. There are other causes, from a pinched nerve to certain vitamin shortfalls to side effects of medicines. So I am not telling you that tingling toes mean you definitely have diabetes. I am telling you it is a common and important cause, it is easy to test for, and it is far better to check and be clear than to guess and be wrong. Get the blood test. Let it tell you. So let us bring this together, because you now know how to read something most people walk right past. Here is what to do, starting this week. 1. Get your blood sugar checked with a simple blood test, especially if you have any of the foot signs or a family history of diabetes. 2. Start a daily foot check. Look at the tops, soles, and between the toes for cuts, blisters, dryness, or color changes, using a mirror if you need one. 3. Protect your feet. Well-fitting shoes, no barefoot walking outside, careful nail trimming, and moisturizer on the dry areas but not between the toes. 4. Act fast on any wound. A foot sore that is not healing, or any redness, swelling, warmth, or drainage gets prompt medical care, not a wait and see. And underneath all of it, hold on to the reason this matters. Caught early, this is one of the most preventable serious complications in all of medicine. Now, one clear line before we finish, because it matters. Everything I gave you today is education, not a prescription, and it is not a substitute for your own doctor. I cannot see your feet or your lab work through a screen. But the red flags are worth repeating, because they are the ones that cannot wait. A foot wound that will not heal, spreading redness, swelling, or drainage. A fever along with a foot sore, a foot that turns suddenly cold, pale, or severely painful. Those are not things to watch for another week. Those get a call to a doctor, and some of them get one today. And here is the thread I want to leave you with. Today was about the signals your feet send. But the feet are not the only place high blood sugar leaves an early mark. Your eyes show some of the very first changes too, often before your vision seems any different, and there are quiet signs there that most people never think to check for. In my next video, I am going to walk you through the early warning signs of high blood sugar that show up in your eyes, and what to ask your eye doctor to look for. Subscribe so it lands in front of you. Whether you are 45 or 75, you are never too early and never too late to protect your feet and catch this in time. And the version of you 10 years from now will be grateful you started paying attention today. I am Dr. Hale. Take care of yourself.